Welcome. Today we'll be discussing a relatively rare but serious disease of the urinary system, penile cancer. This video aims to provide a comprehensive overview, covering everything from causes and symptoms to diagnosis, treatment, and prevention. Please remember this video is for informational purposes only and does not constitute medical advice. Always consult with a healthcare professional for any health concerns. The exact cause of penile cancer isn't fully understood, but several risk factors have been identified. Human papillomavirus, or HPV infection, is strongly linked, particularly HPV types 16 and 18. Phimosis, a condition where the fourth is difficult to retract, is another significant risk factor, potentially due to poor hygiene and chronic inflammation. Smoking is also a contributing factor, as the carcinogens in tobacco smoke can damage penile cells. Other risk factors include increasing age, weakened immune systems, and a history of certain skin conditions like lichen sclerosis. Penile cancer typically begins in the skin cells of the penis, most often the squamous cells. When these cells undergo uncontrolled and abnormal growth, they form a cancerous tumor. Chronic inflammation and HPV infection can disrupt normal cell growth and DNA replication, leading to the accumulation of genetic mutations that promote cancer development. As the cancer progresses, it can invade deeper tissues of the penis, including the erectile bodies, urethra, and even lymph nodes in the groin area. This invasion can disrupt normal function and lead to significant morbidity. Penile cancer is considered a rare malignancy, accounting for less than 1% of all cancers in men in developed countries. However, its incidence varies significantly worldwide. It's more prevalent in developing nations, possibly due to limited access to healthcare, lower rates of HPV vaccination, and less awareness of preventive measures like circumcision. The average age at diagnosis is typically in the 6th or 7th decade of life, but it can occur in younger men as well, especially those with HPV infection. The signs and symptoms of penile cancer can vary depending on the stage and location of the tumor. Common early symptoms include a change in skin color or thickness on the penis, particularly on the glands or foreskin. A lump, sore, or ulcer that doesn't heal within a few weeks is another concerning sign. Some men may experience bleeding or discharge from under the foreskin or from the lesion itself. As the cancer progresses, pain, swelling, and enlarged lymph nodes in the groin may develop. It's crucial to seek medical attention promptly if you notice any of these changes. Diagnosing penile cancer typically involves a thorough physical examination by a doctor, who will carefully assess the penis and groin area. A biopsy, where a small tissue sample is taken from the suspicious area and examined under a microscope, is essential for confirming the diagnosis. In some cases, imaging tests such as MRI or CT scans may be used to determine the extent of the cancer and check for spread to nearby lymph nodes or other organs. These imaging tests help in staging the cancer and planning the appropriate treatment strategy. The most common type of penile cancer is squamous cell carcinoma, accounting for over 95% of cases. Other less common types include melanoma, basal cell carcinoma, adenocarcinoma, and sarcoma. Squamous cell carcinomas are further classified based on their microscopic appearance and degree of differentiation, which can influence treatment decisions and prognosis. Staging of penile cancer, based on the TM system, tumor, node, metastasis, is crucial for guiding treatment and predicting outcomes. This system assesses the size and extent of the primary tumor, involvement of lymph nodes, and presence of distant metastasis. Treatment for penile cancer depends on the stage and type of cancer, as well as the patient's overall health. Early-stage lesions may be treated with topical creams, laser therapy, or surgical excision. More advanced cancers may require partial or total penectomy, which involves removing part or all of the penis. Radiation therapy and chemotherapy may be used as adjuvants after surgery to kill any remaining cancer cells or to treat metastatic disease. Lymph node dissection, the surgical removal of lymph nodes in the groin, may also be necessary to prevent or treat the spread of cancer. Several preventive measures can help reduce the risk of penile cancer. HPV vaccination is highly effective in preventing HPV infection, which is a major risk factor. Practicing good hygiene, including regular washing of the penis and foreskin, is also important. Circumcision in infancy has been shown to significantly reduce the risk of penile cancer. Avoiding smoking is another crucial preventive measure. Regular self-exams of the penis can help detect any changes or abnormalities early on, enabling prompt medical evaluation. The prognosis for penile cancer varies depending on the stage at diagnosis. Early-stage cancers that are confined to the penis have a high cure rate with appropriate treatment. However, the prognosis worsens when the cancer has spread to lymph nodes or other organs. Recent research is focused on developing more effective treatments for advanced penile cancer, including targeted therapies and immunotherapies. Clinical trials are also exploring the use of novel approaches to improve survival and quality of life for patients with this disease.